So a couple of notes in response to the Medicare for All shtick. So this is Bernie Sanders shtick, obviously. The problem with Medicare for All is that when people say that it's affordable, this isn't affordable to the person who has the Medicare. It is not affordable to the country. In fact, it is so unaffordable to the country that the state of California was a nut job leftist state, just refused to even pass Medicare for All because it would have immediately doubled the debt. As far as the idea that medical care is a right, but it's not actually a good or a service, this is a way to make things less plentiful. If you declare things rights, but you don't actually incentivize the creation of those things, you don't get more of them. So the South African Constitution has right in there that healthcare is a right, that housing is a right. The fact is that you don't have good housing or healthcare in South Africa because just declaring things rights does not make them appear. What makes more things appear is a market-based system that creates more doctors, that creates more medical care, that creates more incentive for people to join up. So my wife is a doctor. That means she has to go through 1,000 years of medical training, and we have to spend hundreds of thousands of dollars to make her a doctor. The idea that you're going to have the government come in and then dictate the sort of care that she should provide to each particular patient, and then dictate how much she should be paid for that care, is going to lead to a decrease in the number of people who are going into the medical industry, which decreases the level of care overall. This is why I say that it is better to treat things as goods than as rights, because declaring something a right just means that you have the right to steal it from me. But declaring something a good means that you get a market process that leads to lower prices and better care over time. And the big problem we've had before Obamacare is that it was already treated quasi as a right. You had it heavily regulated on the state level. It is continually heavily regulated. The idea there's a completely unregulated market is absolute nonsense. The reason that you have employer-based health insurance in the first place was as a response to wage and price controls placed in the aftermath of World War II, and employers began giving health insurance as an actual good, right? They gave it as an actual incentive to their employees. If you had an actual individual-based health insurance market, you bought it just like you bought your car insurance, you would see more and better health care for everyone. The idea here seems to be that unless you declare medical care a right rather than a commodity, you're soulless. That, as Marx might put it, necessity rather than autonomy creates rights. This is foolish, both morally and practically. Morally, you have no right to demand medical care of me. I may recognize your necessity, I may offer charity. My friends and I may choose to band together and fund your medical care. But your necessity does not change the basic math. Medical care is a service and a good provided by a third party. No matter how much I need bread, I do not have a right to steal your wallet or hold up the local bakery to obtain it. Theft may end up being the least immoral choice under the circumstances. That doesn't make it a moral choice or suggest that I have not violated your rights in pursuing my own needs. But the left thinks that declaring necessities rights somehow overcomes the individual rights of others. If you're sick, you now have the right to demand that my wife, who is a doctor, care for you. Is there any limit to this right? Do you have the right to demand that the medical system provide life-saving care forever to the tunes of millions of dollars of other people's taxpayer dollars or services? How exactly can there be such a right without the government rationing care or using compulsion to force individuals to provide it or confiscating mass sums of wealth to pay for it? The answer, nope, doesn't work that way. Rights that derive from individual need inevitably violate individual autonomy.
You said that if you had to go find a cheap X-ray or a cheap armchair, you would go to find an armchair.
If your life depended on, you have to find a chair today and buy it now.
Yes.
Versus you have to find an X-ray and buy it now. You would buy the armchair, yes.
Yeah. So my question is, part of what allows you to find a cheap armchair is that there's such a difference in quality.
Yes.
You know, you can go and buy a chair that's $5, probably going to break soon. But
Yep.
So with healthcare,
which I said in the piece, actually.
Yeah. So with healthcare, if it's something you don't really want to go like some guy who's offering a $5 X-ray and say, hey, you want an X-ray? You know,
why?
So, because if your life depended on it, I don't think that it would be a situation where you'd be willing to risk the.
So let me ask you this: why should an X-ray cost $200, $1,000 through an insurance company? It's literally a machine, and an X-ray technician takes a picture of it and then sends it to a radiologist who actually looks at it. Right, or a doctor looks at it.
So I don't know enough about the healthcare industry to answer that. But
the reason I'm saying this is because what I'm saying is that one of the reasons these things are so much more expensive and so much less competitive is because you do not actually have a free market in healthcare. You have a heavily, heavily regulated market in healthcare. If you want cheap X-rays, you have to have a competition in the X-ray business. There is no competition in the X-ray business. You can't go and look up a list of X-ray companies that are going to give you an X-ray today and then call them for the lowest price. In fact, if you go into the doctor right now and you say, I want you to take a look at this X-ray, how much will it cost me? The doctor will tell you, I can't give you that answer. Right? The doctor will tell you, I'm going to have to talk to your insurance company, or maybe I'm going to have to run it through my system, and then I'll get back to you. Is there any other product in America where if you went into a restaurant, you said, how much is that cup of coffee? They said, drink the cup of coffee, we'll tell you later. Right? It's not a free market. The point that I was making with the armchair comparison is not, of course, that armchairs are morally equivalent to healthcare. Obviously, people need healthcare more. Okay? Perhaps a better comparison would have been bread, right? Because people need bread. Okay? But the reason that bread is cheap is because there's a free market in bread, not because government is subsidizing bread. So the point that I was making is if you actually want to increase supply, the point I was making in that column, and overall about this, is that healthcare is not a right. Healthcare is a commodity. And the difference between those two views is that if you think healthcare is a right, now you're going to use the government to cram down on doctors that they must serve you at a particular price, or cram down on taxpayers that they have to pay for a certain level of your care, or cram down on insurance companies that they can't be insurance companies anymore. They have to be health coverage institutes, essentially, which is when they say that you have to accept pre-existing conditions, it's not an insurance company anymore. If you had a fire insurance company and they said you have to accept pre-existing conditions, it would just be called the piggy bank. Right? You'd burn down your house and then go get fire insurance. So the insurance companies don't work that way. So the point I was making is if you view it as a commodity, you're going to end up making it cheaper, more plentiful, more available, more competition. And the case in point of this is LASIK eye surgery, which is really unregulated. So LASIK eye surgery used to cost like $20,000 an eye. Now it costs $3,000, $4,000 an eye. The reason for that is because the insurance companies won't cover it and because there's a competitive market, because it's really expensive, right? So lots of doctors now want to be optometrists or ophthalmologists and do this sort of work. So, what's the solution for poor people? Well, not to declare medical care a right, certainly not to dismiss reliance on the market as some sort of perverse cruelty. Markets are the solution in medical care, just as they are in virtually every other area. If you treat medical care as a commodity, that means temporary shortages, and it means some people won't get everything we wish they would have. But that's also true, but worse, with government-sponsored medical care, as the most honest advocates will admit. And whereas government-sponsored medical care requires a top-down approach that violates individual liberties, generates overdemand, and quashes supply, markets prize individual liberties. They reduce demand. You don't demand more of what you have to pay for. And they heighten supply through profit incentive. So, back to the furniture now. Let's say your life depended on this choice today. You either have to obtain an affordable chair or an affordable X-ray. Which would you choose to obtain? Well, if you're not stupid, you choose the chair. That's because there are lots of types of chairs, produced by scores of different companies, widely distributed. You could buy a $15 folding chair or $1,000 antique without the slightest difficulty. By contrast, to obtain an X-ray, you'd have to work with your insurance company, wait for an appointment, and then haggle over price. Why? Because the medical market is way more regulated, thanks to the widespread perception that healthcare is a right, than the chair market. Does that sound soulless? True soullessness is depriving people of the choices they require because you're more interested in patting yourself on the back by inventing rights than by incentivizing the creation of goods and services. In healthcare, we could use a lot less virtue signaling and a lot less government. Or we could just read Bernie Sanders' tweets while we wait in line for a government-sponsored surgery, dying, presumably, in a decrepit chair.